Production and distribution of City Club forums on IdeaStream Public Media are made possible by PNC and the United Black Fund of Greater Cleveland, Incorporated.
Good afternoon and welcome to the City Club of Cleveland, where we are devoted to conversations of consequence that help democracy thrive. It's Thursday, January 30th, and I'm Emily Campbell, President and CEO of the Center for Community Solutions, and the moderator for today's conversation. Can we give another round of applause for this remarkable film? And perhaps I'll take a deep breath as we head into this conversation. Like Curtis, the National Institute on Drug Abuse reports that about 1 out of every 8 kids in America grows up in homes with someone who has a substance use disorder. And according to the CDC, fentanyl was responsible for nearly 70% of drug overdose deaths in 2022. Today, the film Inheritance placed each of us on the front lines of the opioid crisis in America and here in Ohio. Joining me on stage to discuss more about the film and dig deeper into some of the core topics is Amy Tonsig, director, producer, and writer of the film. You saw her name several times in the credits. If you have a question for Amy, including those joining via our live stream, you can text at 330-541-5794. City Club staff will try to work it into the conversation part of the program. Members and friends of the City Club of Cleveland, please join me in welcoming Amy Tonsig.
Thank you so much, Emily.
So let's start with the question that is probably on most people's minds. The filming of this film wrapped a few years ago. How is Curtis today?
Well, thanks again for having me here, and thanks for having the film Inheritance here. This is an amazing place to have our film be discussed and watched. Curtis is 20 years old this month, and about a year ago, we premiered the film in Park Lake City at the Slam Dance Film Festival. Soon after that, we started our impact campaign. That means we went on the road with the film and doing events like this where we screen and have discussions. And Curtis joined us. The first screening that he came to was in Washington, D.C. last June, and proceeded to come to multiple other screenings and do Q&As like this. When he was with us in D.C., it was his first time out of Southeast Ohio. First time on an escalator, first time staying in a hotel room, and we did 7 meetings on Capitol Hill, and he did amazing. He's living on his own, and he is working on pursuing his GED, and not sure what's going to happen after that, but he's 20, and he's finding his way.
You know, the title of the film is Inheritance. And we see this family and 5 generations of the family. What do you believe is the inheritance of the family depicted in the film?
You know, when we named it Inheritance, so my husband and I made this film together, Matt Moyer. We directed and produced this film together. We're both longtime photojournalists. This was our first film, and it was an 11-year project. And it was a sort of just do it as we can project. And it had a lot of different names over the years. And then at some point, we landed on Inheritance because, one, I think over time we started to see so many generations in this family. And what we saw was it's on multiple levels, but it's passed down, as John said in that interview. It's something, you know, we're not doctors, we don't literally mean it, but it's something that is carried down in the family until that cycle is broken. And that would be really the inherited trauma I think, and then all that comes along with it. Doesn't have to be opioids. It can be alcohol. John addressed that. Uh, it can be any sort of soother to what they're grappling with in their community and within their own home.
You know, you mentioned that you're a photojournalist. You and your husband are photojournalists, capturing a snapshot in time. And when you think about something like film, you know, there's a lot of, I'm sure, filming over more than a decade. There's patience that goes into it. There's waiting for the right moment. What is the snapshot that you hope that people take away from this film?
Yeah, that's a great question, because I actually think still photos are almost more powerful than film, but that's a whole
They
nother
can be.
discussion.
That's a different forum.
But I like that framework because I do think that inheritance represents a moment in time in America right now. It is about our communities, the structure of our very communities. You know, what sort of support does a kid like Curtis have to walk away from the mental health struggles in his family? What's going on in America today? And I think it is I don't want to say snapshot because that sounds a little, but it's a still photograph.
It's a little trite, but
yeah,
sure.
it's a still photograph of America. And it's over a long period, I think, that America has been grappling with these very issues. It's not just like it's yesterday. It's decades that this has been in the making.
And one of the things about this film that I was really struck with is that the trust that this family must have. The cameras are rolling. There are things captured on camera that, you know, if it were my family, I wouldn't want others to see in this public forum. Can you talk a little bit about how that trust was built to have this family allow you all as filmmakers into their lives over this long period of time?
Yeah, I would say that goes back to us being photojournalists. My husband Matt and I started our careers at newspapers. We met at National Geographic. We're both National Geographic photographers. We have always worked on long form journalism with our photography. And in order to do that, you need to be able to build relationships, and it's all about building relationships. There is a beautiful thing that happens, I feel like, as a storyteller, especially as a visual storyteller. You have to bear witness to all that's going on to actually show a powerful story as a visual storyteller. And so you have to show up. You have to be there. And I think just in that action of showing up and really making it clear to people that their story is important and we want to know them and see them, I think that's a big part of it. And then I would say, I know I speak for my husband, you have to give so much credit to this family for their bravery to tell their story, and they truly, truly saw the value in telling this story for larger populations. They were on board. They were fully on board and know that it's an important story to tell.
Yeah, and I want to talk a little bit more about this story to tell and this particular family as, you know, an example of what happened in America, what continues to happen in America, but certainly through the opioid crisis. You know, in the intro, we talked about how 1 in 8 children in America are growing up in a home with someone who has substance use disorder. It's 100% of the children in this film. And so these kind of issues aren't spread evenly, and they talk about being in Pomeroy, Ohio, and everyone in their family struggling with addiction at various points. You know, drugs are everywhere. You know, when we see these kinds of stories, we often also see the other side. We see law enforcement, or we see sort of the people who've left, the people who've made it, so to speak. Can you talk a little bit about only showing the family's perspective and sort of being in it and not people that are around them, or sort of other external, perhaps, support systems, or maybe systems that aren't supporting them?
Yeah, and this would be very much the filmmaker's journey, right? We definitely, and we spent quite a bit of time interviewing experts, and that ended up really being our reporting, was in that time that we spent interviewing the judge and Gallup police that sees a lot of these families. The district attorney went to high school with JP and Yuva, Curtis's mom. Um, we we spent a lot of time on that. And then at the end of the day, as filmmakers, then you're really speaking an emotional language. And we also feel like the country as a whole, nationally, we have a language for what's going on here. And it wasn't our job to tell the whole story. It was our job to tell the most emotional story and the strongest story. So we don't show this assuming that people are going to think like, oh, that's all of Southeast Ohio. This is a deep, deep dive into one family, 5 generations. This is not data proven, but what we mostly heard from local law enforcement is that Curtis's family represents maybe about 30% of the kids in that region. That might be conservative, actually.
I bet it's higher.
Yeah, but I don't think it's our job to tell everything. It's in the context of our national discussion about this.
Absolutely. And thinking about kind of the family, one of the things that comes through is a lot of love. There's an awful lot of love in this family. And in particular, when I think of the two people that are almost the matriarchs of the family, Grandma Bean and Cheryl, you have two different kinds of love there, really some tough love portrayed from Grandma Bean. And then with Cheryl, it seems much more unconditional. And, thinking about families and support and love, how does some of that come through or not come through in the film, and how important is that to sort of the day-to-day lives of the experiences portrayed?
I think that the love that you all saw in the film and that we witnessed as filmmakers, and I give a huge hats off to my husband because he did most of the cinematography on this. As you might imagine, he had to really build that relationship. And who's behind the camera matters, right? It matters. How we are represented, who we're seeing, how we're seen. It has an impact, and it's important whenever looking at a film or photographs to know who was behind the camera, because that's the author. And I think this family truly has a lot of love, and I think my husband was incredible at capturing it and seeing it. And the editing process as well, that was a really, really important part of the film, because it's a pretty darn sad story, right? And I think one of our biggest goals always is to humanize the stories that we're telling. And I think it comes through in this film.
Yeah, absolutely. Certainly humanizes people that are sometimes statistics. I mean, we've talked about some of the statistics already here today. We're sitting here this afternoon in Cleveland, Ohio. We are not that far. It's a drive down. You get on 77 and you keep going and you'll be there. There's towns much closer to home that look very similar to this. And since the film debuted, you and others have been traveling around the country, sharing it with various audiences. What do they ask about Ohio and about this place that the film is based? And how might the reactions be different, as you've gone through Ohio versus other parts of the country?
I think, as we all know, this is happening everywhere in America. This is happening, and I actually think there might be more in common with what's happening in some of our cities as well, even though this feels very rural, but there's some of the same economic issues. accessibility issues, resources. This is really, I think this is mostly a film about resources in a lot of ways, if you're going to break it down to solutions and how
Right.
people handle it. And that's across the board. I think I don't know. I'm curious about Ohioans and how they feel about this. I don't think this is specific to Ohio, though. But what we do encounter is a lot of folks that can relate. We meet a lot of. We've showed at a lot of places where there's mental health workers, people who are in social work, foster care, education, and this is not surprising. This film is not surprising to folks. It's more like, thank you for recognizing something that's happening and that we need to talk about.
You know, there was a fairly recent, last year, profile in the New York Times about Curtis, kind of tying it in with Vice President Vance and Hillbilly Elegy. Can you talk a little bit about this film in the broader national conversation around addiction and around this region of the country? And one of the things that struck me in that article was Curtis talked about how, well, J.D. Vance is one of the people who escaped. I think he used the word escape or made it or something along those lines.
Yeah, that was interesting, right?
Yeah,
like
right.
he saw it in that context, and I think you know, that article was so, I was so appreciative of Robert Draper, the writer, to go and kind of further the reporting, and it was almost like having an update, and it was in the context of the politics, because
It was a little bit of an update.
it
Yeah.
was an update, but it did contextualize it with the politics, and I think that it's important because policymakers need to pay attention to what's going on. And, you know, you would hope that somebody like J.D. Vance would understand it. As you saw in the article, he didn't really when somebody who was working in the mental health field addressed him about it.
Right.
So I hope that this film, and maybe more like it, or the books, or reporting, anyone who wants to tell this story, it's a really important one to keep telling, because we need for policymakers to see it and know it and accept that it's real and that resources are needed.
So we will be turning to questions from the audience or text questions in just a moment. But a couple more things. You know, one of the things that's palpable in the film is the intertwining of poverty and addiction, and also, you know, the intertwining of faith and religion, and some of those kinds of things. And, you know, these are multi-layered community issues. How to choose what to portray, what to focus on, what to leave on the cutting room floor,
Yeah.
and what sort of themes as you're editing to bring out.
So again, we come from a really heavy journalistic background, so we're always have an eye on, you know, what we witnessed. But even that said, anybody who's editing a written story, a batch of photographs for a story or a film, there's a lot of subjectiveness that happens in the filmmaking process. We purposely wanted to make that complex weave. We felt like it best told the story of this family. The religion is really important. We had to cut a lot of the religion out. It probably still had the heavy thing, but there was a lot of moments where we had to like keep pulling it out because we didn't want it to dominate the story. But all of those were intentionally sort of woven in to build the narrative and build the story about them.
You know, and this is filmmaking as storytelling. What story did you set out to tell? And were there ways that it needed to change and adapt as life continued over the course of filming?
Yeah, so the story that we set out to tell with, you know, this was an 11-year project. So, of course, it's going to evolve and change. At first, I think we thought we were telling a story about food insecurity, but then it turned into a story about one family. And then we had to sort of place, which character we're going to follow, how are we going to follow, and it just was a constant changing sort of evolution of where we're getting to. And also, as we started this in 2012, and so we did not understand the opioid epidemic at that point. When we landed on this family, we were like, what's going on here? And then very quickly, we were like, oh, okay. And so we sort of grew with the national discussion about what was happening, and then realized that this family was very representative of something that was happening. And then you just flow with it, maybe to a fault. When you do an 11-year project, there's a lot of filmmakers for budgetary reasons. They have a script and you do it
Right, this certainly was not a script.
No, we just followed it, which is beautiful, but maybe not very economically smart.
All right, before we turn to the audience Q&A, the film ends sort of where it begins. You kind of drop in and you drop out in this one family. But as we're thinking about moving forward, what gives you hope?
Wow, that's a tough week to
I know.
answer that question.
I didn't talk about the week that we're sitting in on purpose.
I just need to acknowledge that. I would say what gives me hope is what always gives me hope. My daughter gives me hope. She's 8 years old. Just with this film, the love in this family gives me hope, and the humanity, and I think it'll always win.
Love always wins.
Love always wins.
Right? Wonderful. Well, on that note, let's turn to audience Q&A. For our live stream audience, I'm Emily Campbell, President and CEO of the Center for Community Solutions and moderator for today's conversation. Joining me on stage is Amy Tonsick, director, producer, and writer of the film Inheritance, which we just viewed prior to this conversation. Of course, we welcome questions from everyone, City Club members, guests, any students, and those joining via our live stream at cityclub.org. If you'd like to text a question for our speaker, please text it to 330-541-5794, and City Club staff will try to work it into the program. Please try and keep your question in the form of a question with a question mark at the end. May we have the first question, please?
Yes, this is a text question. Have you screened this film in Appalachia? I should know this.
Appalachia.
Yes, thank you. If so, how have they received it?
So we've screened, I'm trying to think through like all the places that would be considered Appalachia. I mean, I was in Virginia, we were in Ohio. We screened it, we had our Ohio premiere in Athens, Ohio, just 20 minutes up the road from where this was filmed. And actually for that screening, I mean, this is a little bit of a digression, but is that okay?
You have the mic. Yes.
I do have the mic. So when we finished the film, before releasing it, before premiering it, Matt made a trip to Ohio and had a private screening with Curtis and Cheryl. I think he would describe it as one of the scariest moments in his life, and he covered Iraq in 2003.
Oh my goodness.
And Afghanistan, and anyway. But it was, I think, of course, really emotional, especially for Cheryl to watch it. And I think at the same time, they felt very seen. I think Curtis felt very seen, and he's really on a mission with this film. Like, he wants this story to get out. And then soon after that, we had the Ohio premiere in Athens, and a larger group from Curtis's family came. And
oh, wow.
Yeah, it was amazing, actually. So Matt and I were sitting to the side, and then they kind of filled the whole middle. And it started, and we were just nervous, and very quickly, members of Curtis's family started just having conversations with the family as they're showing up in the film, and it was just this like very powerful encounter. And at the end, there was a lot of tears and appreciation. And I think, and I would say this resonates for me as a photojournalist over the years. Like, we want to be seen. You know, I think it's a human thing. We want to be known. We want to be seen. And film is a powerful way to do that. I think, to answer the question more specifically about Appalachia, I don't have any sort of distinct story, but I think it's resonating. You know, I think people, we have other screenings that are in the works right now in that region, in the Kentucky, West Virginia, lower Ohio region, and I think people want to have it and to talk about what's happening. Yeah.
The next question, please.
Hi, I'm Jody from the Center for Health Affairs, and we recently had a documentary that we produced as well on igniting compassion, and it had to do with recovery and substance use disorder and stigma, and trying to dispel the stigma in the community. Can you tell me how your documentary is addressing stigma? Because I could see a lot of that in the humanization of the story.
Yeah, I think that is for sure one of our prime goals, and the impact, and when we were, you know, approaching the story, editing the story, was our number one goal was humanizing this very statistical issue. Also, a lot of what we found, a lot of the reporting, and it's important reporting. I don't want to dismiss other reporting. We need to see it, but we didn't want it to be all about needles in the arm. We wanted to show that this is so much more complicated than any one drug. This is not just about fentanyl. This is not just about opioids. It's about all of it. This is not about the border. This is about America and what we're grappling with internally in these communities. And that was really important for us to show that that is very hard to make a film on. It was very challenging, but that was very important for us to destigmatize a very sort of stigmatized topic. Yeah. Hopefully it worked.
The next question, please.
Hi, my name is Angelo Capitone from Recovery Resources. I just want to know, what would you say to somebody who maybe would say that these people are making personal choices and it's not the responsibility of everybody else or the government to make changes to help these people escape the cycle that they're in? Because I know there are, people out there who may think that, okay, they're making personal choices, they're flushing their life down the toilet. Why is it important to me?
Thank you for that question. I am not a doctor, but so my limited understanding is that these are not choices, that addiction is not a choice. There's choices around it, but it's not a choice, and that this is actually a mental health crisis. And it's way more complicated than somebody just making choices. I don't feel like I speak as eloquently maybe as a professional about addiction would, but that would be my take on it. This is much more complicated than this, and it's our job as community members to support folks who are struggling with mental health issues.
Hi, my name is Michael Perry. I work in nonprofit fundraising, and early in my career, I worked for a substance abuse treatment center. And I remember the executive director saying that addiction recovery or addiction itself needs to be looked at as a disease of the body, mind, and spirit. That successful long-term recovery, you need to engage a person's body, mind, and spirit in the recovery process. And your film seemed to indicate that, at least to me. And I was curious if that's what you saw as you were doing the film with those who successfully recovered and got into onto a good recovery path.
Well, first of all, I think you much more eloquently described addiction than I ever would. And I don't feel, in our experience with the film, we didn't follow somebody through recovery. So I don't really have that firsthand experience. We saw a family that was really limited with resources and, battling this stuff to different degrees. And actually in a community where sort of recovery houses and access to them is just kind of, it doesn't even make sense. People can't get anywhere. Like it's so in a different world to be in those areas and to be battling this sort of thing. It's so much about access, and this family just doesn't have access. So I wish I could speak to somebody doing that, but I don't feel that experienced witnessing somebody going through recovery and what that means.
Thank you. The next question, please.
Hi, this is the second time I've seen your film, and it wasn't any easier the second time to see it. I saw it at the Chagrin Documentary Film Festival.
Oh, thank you for watching.
Yeah, well, we had a panel there, and the mother from Orange said, "That's not my family," but yet she still lost a child as a result of this the same crisis. So when people think of it, that's the river. No, it's on our river, the Chagrin River, right here in town, by the way. There's a group of us here in town because we know that Northeastern Ohio was where Judge Polster had all the money for the opiate crisis, and we were known as the Opiate Crisis Center in Cleveland. And I don't know whether you could help us on this, but we've created an opiate innovation fund to see whether or not there's a possibility that there might be some other solutions to help contribute to the solution. And that would be, is there a product? Is there a process? Is there software? Is there coding? Is there anything you might have come across that you said, gosh, if we only had this. And I know that there's an individual who's already come to us with a group, an idea, and it's already well developed. It's actually a vaccine to stop fentanyl from going from here to here. And so that's world changing. And we hope it's going to take place here in Northeastern Ohio for it. If you've come across any idea, as wild and crazy it might be in your process, have you seen or thought and said, gosh, if we only had, it might help?
Yeah, I guess and thank you again for watching. I think what I would say is, like, let's stay in touch, and please know that you could utilize our film for any sort of impact. We have not witnessed any quick fixes, especially for a family like Curtis, because I think it's not just about the drugs. I think it's a bigger community level issue. It's about the support he's getting in school. It's about teachers understanding what's going on for him. I mean, Curtis's biggest wish was that his teachers would watch this film. So I think it's a mental health of an entire community that needs healing and repair. From my limited, I'm not an expert, I'm a filmmaker, photographer, but that's what I saw. It's a much broader community problem.
Thank you.
My question is about photography. You mentioned that you strike relationships, and this is such an intimate relationship. So how do you start that? I mean, you send out flyers, go to churches, stand on a street corner and ask? I don't know. I'm just curious.
Thank you for that question. It happens in all the ways that any relationships happen, right? It happens, there's research as a journalist and knowing what story you want to tell. And then and then going on the path to find the people that you think might help you with the